Yes, I think that we need to, as dentists, understand that we have an incredibly important role to play in the identifying patients who have sleep apnea, and then also providing solutions for them that are comfortable and to fit their lifestyle and to actually help them become better and get this epidemic of sleep apnea under control. There are, potentially 2 million patients within Australia. Even if there's only 10% of people who have sleep apnea in Australia, that's 2 million patients, and they say that only about 10% of those are actually in active treatment for sleep apnea. So there is a huge market out there, but it's not about the market, it's about the human beings who are suffering and not realising that they can be helped. And they're turning up in your dental surgeries. They're turning up with broken down teeth, acid erosion, tori in their mouth, lots and lots of different signs that we see in our practices, and we just go ahead and fix the broken tooth, but we don't ask why it happened. Breakdown in dentistry does not occur in isolation. We have got an incredibly important role to play in identifying these potential sleep apnea patients. So that's the number one reason. Secondarily, we have a role to get those patients well. And it's not just about sticking their jaw somewhere and giving them a hole that they can breathe through. Let's make the patients as well as they can be. So we have to approach this from a physiologic perspective, not a mechanical one. We need to understand that sleep apnea is a very serious medical condition that is affecting a large number of your patients. I would suspect that at least 25% of your practice would potentially be candidates for having some treatment for this. In a recent program that we held here in Australia, we tested the dentists in the class who did not already have a diagnosis of sleep apnea. 78% of them came up as having an AHI of greater than 5. 78%. Now that's in dentists who you'd think would be relatively healthy people. Well, they're not, but anyway, you would think that that would be something that would be under control. So if that's within the dentist, what's happening within the patient group that you have? We need to get on top of this epidemic that's happening at the moment. I want people to give the best care they can give to patients. I want you to fully understand what it is that we're dealing with. I want you to understand the physiology, and I'll teach that in a way that makes it a part of your being, so you understand it, not learn it, understand it. Because when you understand it, you can communicate with your patients and then get them to see the importance of getting proper treatment. It's a wonderful course that goes over 3 days. I'm passionate about it. You may be able to recognise that. I've just completed my master's degree in sleep medicine. I didn't do that as a joke. This is a serious issue, and we need to, as dentists, take responsibility and help our patients. If not us, then who?